Bed mobility is the ability to move and reposition your body while lying in bed. This includes rolling, scooting, and moving from lying down into a sitting position. For individuals living with Parkinson's disease, these movements can become more challenging over time. In this video, we will review strategies that can help make bed mobility easier and safer. These techniques focus on breaking movements into smaller steps, using momentum, and making movements larger and more intentional. Many individuals with Parkinson's disease notice that movements in bed begin to feel slower or more difficult. This often happens because Parkinson's can cause stiffness in the muscles, also known as rigidity. When the body feels stiff, it can be harder to rotate or shift positions while in bed. Another common symptom is bradykinesia, which means slow movement. This can make it harder to start a movement, such as rolling or sitting up. Parkinson's can also reduce natural trunk rotation, which plays an important role in movements like rolling or turning. Because of these changes, individuals may feel stuck or require more effort to reposition themselves. One helpful technique to reposition in bed is bridging. This can help when scooting up in bed or adjusting your position. For this movement, start by bending your knees and placing your feet flat on the bed. Next, press through your feet and gently lift your hips. This small lift allows your body to move more easily along the surface of the bed. While your hips are lifted, you can shift your body slightly upward or sideways. Then slowly lower your hips back down to the bed. Another technique is log rolling, which allows your shoulders, hips, and legs to move together as one unit. This can help reduce strain and make rolling easier. Begin by bending your knees while laying on your back. Reach one arm across your body in the direction you want to roll. Turn your head and shoulders toward that direction. As your upper body begins to move, allow your hips and legs to follow together. Thinking about making your movements larger and more intentional can help initiate the roll. Some people also find it helpful to count out loud, such as 1, 2, 3, roll. Another helpful cue is thinking about making the movement bigger than you normally would. Large intentional movements can sometimes help the body overcome stiffness and begin the motion more easily. Now let's talk about moving from lying down to sitting. Once you have rolled onto your side using your log rolling technique, the next step is to move into a sitting position. Begin by sliding your legs off the edge of the bed. As your legs lower toward the floor, use your arms to push your upper body upward. Allowing your legs to move off the bed can help create momentum that assists your body in sitting up. If starting the movement feels difficult, you can try a gentle rocking motion while lying on your side. Rocking the body slightly forward and backward can help build momentum before pushing up into sitting. After sitting at the edge of the bed, the next step is transitioning safely into standing. Begin by placing both feet flat on the floor with your knees bent and your feet positioned slightly underneath your body. Lean your upper body forward by bringing your nose over your toes. This helps weight shift forward and prepare your body to stand. From this position, push through your arms and legs to rise into standing. If you are standing without a mobility device, focus on maintaining your balance before beginning to walk. If you are using a walker, position the walker directly in front of you before standing. It is very important to stand up first, using the bed or chair for a push-off support, and then reach forward to grab the walker once you are upright and balanced. Avoid pulling on the walker while standing, as this can cause it to move and increase the risk of a fall. Individuals with Parkinson's may also find it helpful to use cueing when standing. Counting out loud, such as 1, 2, 3, stand, can help initiate the movement. Now let's talk about getting into bed. Step 1, scoot all the way back toward the head of the bed so that you are positioned safely and won't need to reposition excessively later. Step 2, slowly lower your shoulders toward the bed while simultaneously lifting your feet onto the bed. Make sure the back of your knees and feet feel the bed firmly to avoid any sliding. This coordinated motion allows the hips to shift back naturally and keeps the movement nice and smooth. Step 3. Use a log roll or pivot technique that we mentioned to lie fully on your back. If needed, use your small bridging technique to help maneuver safely. Some individuals benefit from simple tools that can assist with bed mobility. A leg loop is a strap that can be placed around the foot or lower leg. It allows you to use your arms to help move your leg when repositioning in bed or getting into bed. Bed rails or bed ladders can also provide a stable handhold when rolling or pushing up into sitting. In some cases, a gate belt secured safely to the bed frame may be used as a temporary handhold to assist with pulling or repositioning. If using any equipment, it is really important to make sure it is safe and secure. Bed mobility can become more challenging for individuals living with Parkinson's disease, but using strategies such as bridging, log rolling, and breaking movements into smaller steps can help make these tasks easier. Practicing these movements regularly may improve safety and independence when getting in and out of bed. If you continue to have difficulty with bed mobility, an occupational therapist can help assess your individual needs and recommend strategies, exercises, or equipment that may be helpful for you.